Good afternoon, everyone. This is Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. Thank you for joining us for our press briefing today. I am here with my colleague, our Vice Chair, Commissioner Ken Lawrence. Today is September the 16th, which is week 28 in our pandemic experience here in Montgomery County. And we are in week 12 of the green phase. Since our September 15th press release, we have 29 new cases of COVID-19 reported in Montgomery County, which brings us to a total of 11,519. These positive cases are a result of a positive test for the virus, not from the antibody test. One of these cases is from a long-term care facility. The remaining 28 are from the community. 28 of the 29 tests are from the last 7 days or less. So we continue to see a big improvement in our testing times. These positive individuals are from 22 municipalities. All 62 Montgomery County municipalities are home to individuals with COVID-19. Today's individuals range in age from 12 years old to 83 years old. Of note today, 23 of 29 cases are below the age of 30. As always, you can check our county maps at montcopa.org/COVID-19 for updated geographic information. Today, we have 15 females, 13 males, and 1 unknown. I am pleased to confirm that no additional Montgomery County residents have lost their life to COVID-19, which leaves us at 830 deaths confirmed positive from COVID-19. In terms of beds, we see some nice improvement today. Today, it appears that we have about 28 patients hospitalized with COVID-19 in a Montgomery County hospital. I believe this is the lowest number that we have seen since the very early days of this pandemic, so that is great news. 4 of these individuals, or approximately 14%, require a ventilator. At the Montgomery County Correctional Facility, the situation continues stable with no new cases to report. In terms of our testing, I'm pleased to announce that testing continues to go smoothly in our 5th week with Mako Medical. With rare exceptions, our results are available within the contractually promised 36 hours. Our testing capacity is currently at 50 tests per site per day. So this provides 300 a day across our 6 county sites. Not all of our tests are being utilized at each site each day. So I do want to continue to urge anyone who wants or needs to be tested to get tested. I also want to remind people that we will test children and even infants. We've gotten a lot of phone calls from individuals who are having trouble getting children tested, and we are happy to test children. The more we can test in our community, whether you have symptoms or not, the more we will know about what is happening across our county and be able to quickly suppress any outbreaks. So just a couple reminders about the testing sites. You do not have to have a car to be tested. The sites do require an appointment. All appointments are made on the day of testing, beginning at 8:30 in the morning. You cannot book ahead. We do ask that the person being tested is either a resident of Montgomery County or works in Montgomery County. These test sites will be of no cost to the person that's being tested. If you do have insurance, we bill it, but we don't require any out-of-pocket cost. You do not need an order from a healthcare provider. And again, we will test people of any age. Our sites are in Pottstown, Lansdale, Willow Grove, Green Lane, Ardmore, and Norristown. To register for a test or get more information about the exact locations and the hours that they are open, you can go to montcopa.org/COVID-19 and click on the green County Testing Information button. You can also make an appointment by phone. Phone appointments also open at 8:30 in the morning for the day that you would like to be tested. That phone number is 610-970-2937. Now, we do have a new testing partnership to announce today. Montgomery County is pleased to be part of a partnership with Latino Connections and Acclamo, as well as the Pennsylvania Department of Health, to provide COVID-19 testing and education for Latino residents at 2 locations next week. First is on Monday, September the 21st. We will be testing from 11 a.m. to 3 p.m. at Acclamo in Pottstown, and that's 515 Walnut Street. So again, Monday, September the 21st, Acclamo in Pottstown, 515 Walnut Street. The hours are 11 to 3. Then on Tuesday, September the 22nd, we will be testing at Acclamo in Norristown at 536 George Street in Norristown. Actually, I think it's at the SAC Center at 536 George Street in Norristown. And that is also, I believe, from 11 to 3. All of this testing is walk-up. It does not require any kind of pre-registration or appointment. And again, we're very pleased to offer this additional testing option to Latino residents of either Pottstown, Norristown, or the surrounding areas. Working together, we continue to suppress virus here in Montgomery County. Happily, we are starting to see some stabilization in our positive numbers, but there is still plenty of virus circulating in our communities. Just a reminder, as schools begin to bring students back, keeping this virus suppressed is more important than ever. While many of our 22 school districts are beginning the school year with a virtual format, all are hoping that they will feel comfortable bringing at least some students back in person later this fall or in January. The likelihood of their being able to do this depends on all of us working together to keep the spread of virus in our community to a minimum. That is our goal here. So let's take a look at our weekly graphs and see how we're doing. So we will start with our date of test graph. As a reminder, the vertical gray bars in the background are the number of individuals who tested positive on the date noted along the bottom. The darker red line is our 7-day average, and the pink line is our 14-day average of all of these cases. The dark blue line is our community 7-day average, and the lighter blue line is our community 14-day average. And way down there at the bottom, in the orange and yellow, are the long-term care facility 7 and 14-day average. And you can see what a tremendous amount of progress has been made there. So when we zoom in on our last 30 days, it's a little bit easier to see some of this information. You can see that in the last 7-day average, we've made some progress. Now, just a reminder, these are just the tests through Friday, September 11th. The reason being that it always takes a few days to get enough tests for this data, enough test results back for this data to actually be meaningful. And this is everyone who has been tested that's a Montgomery County resident. But it's very good to see that 7-day average is really starting to come back down again. The 14-day hasn't changed much yet, but obviously, that's going to take a little bit longer to change. So just to give you a sense of this, a week ago, which included our data up to September the 4th, our 7-day average was 49 cases. And this week, with data through September the 11th, our 7-day average is down to 36.3. And as you can see, the 14-day averages are essentially flat. So this is good news. So let's keep up the good work, and we will talk in a minute again about how you do that. But first, let's show our age, which we have updated So this chart just gets, more interesting every time we do it. We've changed the format a little bit this week. And so what you see in the left are the census age brackets. And then the next column is the percent of population that each of those ages represents here in Montgomery County. And then we have the of those individuals that were positive on April 1st and then each month since then. So you can see that over time, we've seen a steady increase in the cases in the 15 to 19-year-old age range, the 20 to 24-year-old age range. And as we've made substantial progress, particularly on long-term care facility challenges, those age ranges have gone down quite a bit. So, this is, I think, data that's very similar to what other parts of the state and other parts of the country are seeing. Some of this does represent students in college, and we're keeping a very close eye on all of this data just to make sure that we have a good understanding of how this virus is spreading in our community. But this is also just a strong reminder that anybody can catch this virus. And this virus will circulate where it has opportunity. So this chart tells the story that our long-term care facilities, for instance, have done just a phenomenal job of protecting seniors in these last few months. And you can see that those numbers are going down because the virus just doesn't have an opportunity to circulate there. But on the other hand, we've seen more and more social gatherings taking place, kids returning to college and not following the rules on their campus. And so all of those things create opportunities for the virus to circulate, and it will do so quickly and easily, and frequently from people who don't even know that they are carrying the virus. So again, we just have to all be careful. We have to all assume that we could be positive in carrying that virus and that virus to someone else. So next, we'll take a look at our positivity graph. And as a reminder, the orange jaggedy line represents the number of Montgomery County residents that were tested on any given day. And then the blue line at the bottom represents the number of those individuals that tested positive. So as of September the 11th, our positivity rate is 3.11%, which is down slightly from the prior week, at which point it was at 3.17%. So I'm always happy to report when these numbers are going down, even if it's just by a fraction of a percent. So again, that's some good news this week. Also, just want to share with you that in these last 2 weeks, we have tested 22,617 individuals, and that is an increase of 190 people being tested compared to the prior 2 weeks. So, this positivity graph is a running 14-day average. And it is always reassuring that when we are testing more people, that we're actually seeing the numbers come down a little bit. So that means that we're getting some good surveillance testing in there, and that we can believe that these numbers are real, that we're testing enough people that hopefully we're catching the majority of the positive cases. So all in all, looking a little better this week than we did last week. However, we're not over. We are not done. There is still plenty of virus out there. So just as a reminder, do not leave home without a mask. Even if you're going out for a walk, just put a mask in your pocket so that in case you run into a neighbor, you can put that mask on to have a conversation with them. Please keep 6 feet distance from anyone not in your household. This is so critically important. The distance really seems to be making a difference when we look at transmission of virus. So please keep that distance. Do your best to keep your hands clean and away from your face. Get tested if you need to or want to. And please, if you get called by one of our contact tracers, please cooperate. Our contact tracing continues to go well. Our team is doing great and continues to grow. The people that we reach are cooperating, but we still have a huge opportunity for improvement here in the county. If the 30 to 35% of people that we leave messages for would just call us back. We're still sort of stuck in a rut here where we're reaching about 65% of the people that we need to reach. If we really want to get this virus down even lower in our community, this is how we do it. It's by making sure that people who've been exposed know that they've been exposed. They can get all their questions answered, and they can be given clear instructions about what they should do next and how to protect themselves and how to protect their families. So this is a big opportunity here, is just to make sure that everyone who gets a call from a contact tracer calls us back. These conversations are confidential. They are not judgmental. Anybody who needs resources to either isolate or quarantine safely will be offered those resources. This is all exists to help and support our community so that we can keep this virus under control. So I have a couple of announcements today. The first is about flu shots. So you've probably been hearing a lot about getting a flu shot this year. I want to be clear that flu shots do not protect you against COVID-19. It is a completely separate virus. But the flu shot does reduce the chance that you will get the flu, or if you do get it, that you will have a severe case. This is especially important this year because individuals with a severe case of the flu are often hospitalized, and some of those individuals need a ventilator to support their breathing. In this time of COVID-19, where we are looking toward the fall when the weather will become cooler and people will be more likely to come indoors, which could increase the spread of COVID-19, we want to do everything we can to keep the pressure off our hospitals and particularly off those ventilators. So by getting a flu shot, the chances of you needing to be hospitalized for the flu or if you were hospitalized go down dramatically. So please get a flu shot. So if you need a reminder about this, you can text Monco Flu to 47177. This flu season, our Montgomery County Office of Public Health is partnering with the Montgomery County Immunization Coalition and Families Fighting Flu to increase flu vaccination rates through text message reminders. So once you text, you'll be signed up to receive personalized flu-related information about where you can go to get your flu shot. So again, you can text Montco Flu to 47177. Next, I just want to announce that our Office of Public Health, which has done an absolutely phenomenal job for the last 28 weeks, is staffing up. And they asked me to particularly mention 2 job openings that we would be so grateful if people would consider applying for. The first is the fact that we're looking for nurses. The office is looking for passionate and motivated nurses who are ready to make a difference in the lives of our most vulnerable residents in Monco. We're really at a crucial time in our fight against COVID-19, and we need more nurses on our team. Public health nurses are at the front lines of our efforts, from staffing test sites to providing rapid on-site field assessments of long-term care facilities, to providing community outreach and information to assist in disease outbreak investigations, and eventually, when the day comes, to provide COVID immunizations. We need public health nurses for all of these very important roles. We're seeking candidates with a bachelor's degree in nursing and with a Pennsylvania license as a registered nurse. Bilingual candidates are particularly encouraged to apply. Secondly, we also need dynamic public health professionals to serve as disease intervention specialists on our COVID-19 response team. Disease intervention specialists work as part of a team to investigate and to obtain required disease surveillance data, to educate and counsel patients, family members, and close contacts to support contact tracing related to COVID-19. And we are seeking individuals with a bachelor's degree in public health or a related field. So for more information on either of these jobs, you can go to www.montcopa.org/jobs with an S, montcopa.org/jobs. And with that, I will turn over to Commissioner Ken Lawrence.
Good afternoon. We am going to give some information about the election today. We are under 50 days from the election. Am I frozen here? No. Okay. And there's a lot of information that's been going around, and we are encouraging people to rely on the county website. Our voter services website has been updated. It's www.montcopa.org/voter services, or the county social media networks, to make sure that you have the most accurate and reliable information. And on our website, you can register to vote. You can check your registration status. You can apply for a mail-in or absentee ballot. You can check the status of your mail-in absentee ballot application. You can cancel that ballot, and you can also find your polling location there. And there's also a list of frequently asked questions that we will have answers to. So if you have a question about something around the election, you should please take advantage of our website. Some important deadlines. No matter how you choose to vote for the general election on November 3rd, you must be registered by October 19th, 2020. Postmarks do not apply, so your registration must be received by October 19th. The last day to apply for a mail-in or absentee ballot is October 27th, 2020 by 5 p.m. And once again, postmarks do not apply here either. We are still waiting for the ballot to be certified. There's a pending lawsuit with the Green Party regarding candidates. And as soon as that is settled and resolved, we will begin printing and mailing the ballots. But to be clear, we have not printed any ballots. We have not mailed any ballots. Ballots will be mailed based on the order in which they are processed. Paper application processing is a few days behind online applications. So that means online applications received after paper applications could get mailed first. And once again, no ballots have been mailed yet. So if you hear that ballots have been mailed, that is incorrect. We know there's concern with the U.S. Postal Service with mail-in ballots. At our last County Board of Elections meetings, we approved 4 satellite locations where ballots can be dropped off. And we will be considering drop-off locations probably early next week. And we will announce them on the website and through social media as well. Once again, the satellite offices are not open yet, and there are no drop-off locations because there are no ballots for people to drop them off yet. Mail-in voters, if you registered with an email, will receive an email telling you when your ballot was received and when it is mailed. And you can also check your status online at www.pa.voterservicespa.gov and find out the status of your ballot if you are registered. We've received a tremendous outpouring of people who want to serve as poll workers, and we appreciate that greatly. That was one of the issues that we had in the primary election. So please be patient. We are going through those applications. Someone will get back to you. We think we have enough poll workers, so you may be asked if you would consider being a tabulator or doing something else around the election. And a lot of people are asking about their polling locations. Our goal is to move as many polling locations as possible back to where they were before the primary. So we will have more polling locations than we did in the primary. Every voter will receive a letter with their polling location. And as these polling locations, as some of the ones that we need to replace are filled, we'll be updating the list. So you can go to the website. Once again, there'll be a tab for Find Your Polling Location, and you'll be able to find where you will vote. But once again, I want to say that in early October, we will have a mailing to every voter in Montgomery County, letting you know where your polling location is. So we know there's a lot of interest in this election. We know that people are anxious to get their ballots. They're anxious for information. We just ask you to please be patient. If you're not able to find the answer to your question on the website, you can email voter services at voters@montcopa.org, or you can call them at 610-278-3275. You may have to leave a message there, so please leave a message with your information, and someone will get back to you to answer your question. So we ask you to please be patient. If someone says that ballots have been mailed, that is absolutely incorrect. Ballots have not been printed or mailed yet. And that concludes my report, Val.
Thank you, Ken. And with that, I will announce that our next virtual briefing will be Wednesday, September 23rd at 3 p.m. And I'm happy to take any questions.
Thanks, Commissioner. This afternoon, we're joined by Jim Melward from KYW. Jim?
I remember to mute and turn my mic up at the same time. Several schools have started. What, if anything, are you hearing from those districts? And is there any school-specific data?
So what I can share with you is that we've had both some public schools and some private schools that have brought students back onto campus. As we anticipated, there have been positive cases at some schools. Now, I want to be really clear what I mean when I say that. As I've said, and you've heard me say this from the beginning, that we fully anticipated that every school would have cases because there's just virus in our community and people are catching that virus. What we're particularly focused on when it comes to our schools is whether or not there's any transmission of that virus within the school. So for instance, if a student acquires the virus outside of school, comes to school, does another student or a staff member or a teacher catch the virus from that student? So far, we have seen no transmission of the virus within any school. All of our schools are working very hard to put in place all of the same mitigation measures that I'm seeing all of the public to take, which is masking, physical distancing of desks. Many of our schools have bought these sort of threefold sneeze guards that they're literally putting on each student's desk. Hand sanitizer, cleaning protocols, all of those things have been enhanced. So far, we've not seen any transmission. There are schools with cases, and those schools are communicating that information to their school families.
And to be clear, I think you touched on it, but I was messing with levels. Have there been any cases that were spread in a school? Did anyone get infected in a school or in a classroom that you know of? As
of today, I don't know of any spread within a school.
Okay. And a similar question, we talked last week about colleges in Montgomery County. Any information or updates from those colleges?
Still pretty quiet, actually, in our Montgomery County colleges, which is great news. Many of them, I think all of them, worked with our Office of Public Health on plans, and so far those plans seem to be working. But I would like to just clarify one thing about college students, because we've gotten some questions about our numbers changing from day to day in terms of numbers of positive cases. And when we get our list off of the Pennsylvania Department of Health system every day, we start contact tracing, as you know, and we are finding that almost every day now, there are 1 or 2 or sometimes 4 or 5 of those positive cases who are college students whose home address is here in the county. This is their, where their families are, where their home is, but they are outside of the county at a college. If they are isolating at that college, and if that college is outside of Montgomery County, we actually take them off of our list, and their case gets transferred to the case count for whatever county in the United States they are in. Separate from that, if a person is at college and comes home to isolate because they've tested positive, then they would stay on our list because now they're in our county as a positive case and they're here. So we would count them. So hopefully that will help explain for people that are following our numbers very, very closely that there has been some day-to-day fluctuation in the last couple of weeks, happily always downward as we've removed people from our counts.
And so we dealt a lot with this early on with the difference in numbers between the State Department of Health and your Office of Public Health. With what you're saying, then it makes sense that people should be looking at your numbers rather than with that in mind, with the colleges and being able to separate out those aren't necessarily correct, separated out of the state numbers, but they are separated out of your numbers. So your numbers are more accurate.
Yeah, our numbers are definitely more accurate. I honestly don't know if the state numbers are removing those college students or not. I'd have to check with my team. But what I can tell you is that we definitely are. And even more importantly, frankly, every single day for the last 28 weeks, my team has pulled down our list, deduplicated that list, and checked every single address to make sure that that particular individual is actually a resident of Montgomery County. And we've had this discrepancy in our numbers with the state from the beginning because they don't do that. So our numbers have been and will continue to be the most accurate.
The federal court ruling some of Governor Wolf's measures were unconstitutional. I want to read a quote from it and kind of ask you a question about it. He notes that some of these measures were initially billed as temporary to flatten the curve and protect hospital capacity, but have become open-ended and ongoing, aimed at stopping the spread and preventing new cases. And that's become, ending the quote there, that's become a pretty common refrain from people who are wondering kind of what is the goal now. It was that the messaging early on of flatten the curve, protect hospitals. Now I think you said there are 28 people in hospital, 4 on ventilators. And of what is the message and what is the goal? What are we trying to do? And how do you respond to people who say, look, we did that. It's time to, get kids back in school, sports, crowds. I know parents watching sports is a big one too.
Well, as we've been talking about here in Montgomery County for many weeks, we are living with this virus, and we need to figure out and continue to live with this virus for the foreseeable future. And people have great hope on a vaccine, and I hope that we have one as quickly as possible. But even if we had one tomorrow, the public has to understand that the population of this country is 330 million people. And every vaccine that I'm aware of, at least the ones that are furthest along, I should say, are requiring 2 doses to be effective. So it will take a very long time, probably a minimum of a year for there to even begin to be enough vaccine to vaccinate everybody who wants to be vaccinated. And of course, the first people to get the vaccine will be healthcare workers and first responders and people like that. So the rest of us need to learn to live with this vaccine. I would hope that people can see from other states how quickly this situation can change and how quickly these numbers can start to spike and begin to get us back into a situation where we would have to pull back and consider closing restaurants or businesses, or considering advising schools that they needed to close. Fortunately, we're nowhere near a situation like that because people have been following these mitigation measures with a pretty high degree of success. So the short-term immediate goals beyond living with the virus are to keep these viral numbers low so that our children can get back into classrooms. We have to make our communities feel safe and make our school boards feel comfortable voting to bring children back. And there's still a lot of discomfort out there from families, from teachers, and from other staff. So we have to work together as a community to keep these numbers low. Any parent that wants to get their athlete back on the field that isn't on the field right now, the way we do that is keep these numbers low so that people get a greater comfort level with where we're at, that people learn to understand that we are going to have cases. There is no zero here, not for the foreseeable future. But if we can keep the numbers low, we can manage it and stay on top of it.
And I don't want to get lost in this ruling, but I am curious. One of the measures that was addressed specifically is a limit on crowd sizes. Could the county? Is there a discussion about the county coming up if that were to get ruled unconstitutional? And obviously that's down the road because there's stays and appeals, et cetera. But is there conversation in the county of putting a limit on crowd sizes specific to Montgomery County?
So as I'm sure you heard the governor say yesterday, the governor is planning to appeal Monday's ruling and also ask for a stay of that ruling, which would keep all of the outdoor and indoor limits intact. But should that not happen, our Office of Public Health does have the authority to enact ordinances or issue rules and regulations relating to disease prevention and control. And so as long as that is in the service of preventing the control of a communicable disease, we can take those steps. So we will consider doing that if the stay is not granted or if the governor should choose not to appeal.
A couple more questions. I have a bunch today. Jewish holidays coming up, Rosh Hashanah, and these holidays often see families getting together, maybe kids home from college. Is there a message to those families heading into these holidays, or kind of thoughts on that?
Yeah, I know this is another round of holidays again, where it is just going to be so much shared sacrifice once again. So, it's been interesting. I was asked by one synagogue already, and I recorded a video message to them, thanking them for celebrating Rosh Hashanah virtually. Rosh Hashanah is a time when so many families come together. And this synagogue, as I believe all of the ones in our community are doing, are celebrating virtually. So I would continue to encourage that, particularly if people are traveling home from an area of the country where there's a high amount of disease. They could easily be bringing that disease back here to Montgomery County. You might remember from the first days of our first cases, every one of those cases were from people who traveled either to another part of the United States where there was disease, or out of the country to another country where there was a high burden of disease. And they brought that disease right back here to Montgomery County. So travel in particular, must be done very cautiously. And I think most colleges are actually not letting their students travel home in most cases. But just want to continue to urge caution and continue to follow all these mitigation measures and do everything virtually as much as possible. It's always going to be safer that way.
And the other side of that is there's Jewish private schools that are in person. Is there a message or any concern about kids going back on Monday after being home with families that maybe got together?
Well, I hope that every family will just use common sense and follow these guidelines that we've been talking about now for all of these weeks. And if someone has traveled from out of town from a high level of virus, families do need to be careful. They need to practice that social distancing. They should consider having masks on inside the home. Those are ways, when you decrease the duration of exposure, that close exposure, and you decrease the density of that exposure, which you can do with a mask, those things, while not 100%, will go a long way to reducing the chances that someone will be infected. So caution is the word of the day here. Patience, knowing that we are going to get through this, and hopefully a year from now, it'll look a lot different, at least somewhat different. But a lot can go wrong very quickly. And we've seen that over and over again at these mass gatherings in other states. And sure enough, like clockwork, 8-10 days after that mass gathering, the rates of disease in that community go way up. And we also see that people who attended those mass gatherings are carrying the disease back to their home communities. So these are the choices that everybody has to make. And I just ask you to please make a choice that keeps our entire community safe.
And just really quick, you mentioned families, schools, administrators, teachers, whatever, being concerned or nervous about in person, going back to school in person. What's your opinion on that?
Well, I think that right now in the county, we are in about as good a shape as we're going to be in, for now. Our positivity rate has been below 5% since June the 18th. And although we've been sort of oscillating around 3%, we seem to be holding there, which is good. And just a reminder, being under 5% means the virus is considered suppressed. It's not gone, but it is suppressed. We, though, do continue to have a number of cases every single day. If you look at our incidence in the county, as measured by number of cases per 100,000 population, we are in more of a moderate risk category when it comes to the overall risk factors. So putting all that together, I think that schools need to be weighing the risk of bringing people back, of which there's some risk, certainly not going to be zero. Balance that with the risks of not having in-person education. And I do think that that risk increases as children get younger. From what I'm hearing from other parents, that it's the youngest kids that are struggling the most with online learning. So this is the equation that schools have to weigh. And once the school's made the decision that they're going to make, then it becomes to each family to consider their own family's risk and whether or not they have someone in their household that would be particularly at risk if they did get coronavirus, a teacher or staff member. So there's sort of that big picture risk benefit balance of should the school invite children in or not. And then once, if the decision is made for children to come in on campus, then, each individual has their own decision to make. As I have said before, there will be cases, and all of our schools have great plans. We've worked with them closely, and if they are able to implement and adhere to those plans, we believe the risk of transmission within the school setting will be low, but we can't promise that it will be zero. So, we just have to take that whole picture into perspective. The one thing that we don't know is what's going to come in the next couple months. And we are certainly all concerned. Every group that does modeling of coronavirus is modeling that there will be increase in positivity rates, incidence rates, as the weather cools off and people spend more time indoors. So it's possible that we are in pretty good shape now, and that 4 or 5 months from now we may not be in as good a shape. So it's certainly possible that there's kind of a window of opportunity here for schools that did want to bring cohorts of students back, but they need to be able to do that in a way that they can keep that social distancing within the classroom. So, in most cases, they wouldn't be able to bring an entire classroom back together. They'd have to do it on split days or in some other way.
And still, last question, this is a quick one. Is it still too early, or can you say if Labor Day had any effect on totals?
It is not too early. And at this point, we have not seen, happily, much of a bump from Labor Day. Now, we still have it'll be clear by the end of this week and into the beginning of next week to really be sure. But so far, it looks pretty good.
Thanks.
Thanks, Jim. And one last call for any other reporters who are on the line who didn't join us during roll call earlier. One chance for your questions. Okay, hearing none, we will turn it over to Teresa Harris for some questions from reporters who couldn't join us this afternoon.
I just have one question from Justin Hines of The Patch, and you may have already touched a little bit on this earlier. Are there any preparations by the county being made for implementing a vaccine, meaning, making plans to distribute vaccine, and what logistical hurdles does the county face in doing so?
Yes, plans are underway. Our Office of Public Health is working closely with our Department of Public Safety on a plan to do two things. One is that we are planning and have planned from the beginning to use our 6 testing sites as vaccine distribution locations. And then additionally, the county has a pre-existing pod system. And this is a system of setting up locations around the county in a variety of, there's a big list of possible locations for where this can be done. Some of them are in buildings that can be driven through. Others would be setting up tents that you could drive through. So all of that work is in process. And we intend to be fully ready as soon as there is vaccine available to distribute.
Okay, that's all. No more questions.
Okay, great. Well, thank you, everybody. And we will see you next Wednesday. Have a great week.